pen is definitely powerful, positively and negatively. And if I were to make one statement, I would say care must be used when applying pen to paper. And I see way too much evidence that there's pens applied to papers without very much consideration of the content of those papers, speaking specifically of contracts. And obvious, the results of misuse of this important writing instrument are far-reaching, well beyond your individual practice. And we all complain about everybody else for having signed a ding-dong contract, but it really was one of us that signed it. And in many cases, it was 23,000 of us that signed it, or 30,000. And you wonder, really, who didn't sign it? So anyway, we have to take a whole new look at this. So the current reality, I don't think there's any surprise here. Doctors sometimes sign contracts without even reading them. In my experience, answering questions for doctors around the country, I wonder if anybody ever does read a contract before they sign it. Doctors often sign contracts without first considering the impact upon their individual practice. That's clear as well. You don't sign it just because everybody is already on it. If indeed you do your calculations and come up with the fact that your practice will lose money on every one of those patients that you see, then what's the advantage of signing it irrespective of how many other bubbleheads have already signed it? Knowing doctors sometimes sign contracts without knowing the fees to be paid, I cannot believe it. And yet I can believe it because it happens all the time. They'll be shocked to find out that XYZ is only paying $81 for a service that they charge $400 for, and I'll ask them to go look at their contract. Does it have a fee schedule with it? Yes, it does. What does it say? It says $61. What company in its right mind would pay you $600 for something that you've agreed to accept $61? I mean, it's just not the way the world works. This is business we're talking about. It's not fun and games. It's just flat out business. And the sooner we understand it, I can tell you that the people who send you the contracts understand this very, very well. They're very good at it. Witness their balance sheet if you wonder. Doctors often sign contracts without attempting to negotiate better coverage. Oftentimes I'll be at a meeting where, and the repricers are the ones I love, where they'll say that they'll actually pay you within 30 days if you'll agree to take another 15% off your already terrible fees that somebody else has negotiated, and a phenomenal number of doctors will sign that. If they read their state law, they would know that almost every state, if not every state in the nation, says that every clean claim must be paid within 30 days of receipt. You know, so agreeing that if you take an extra 15%, we'll get it done in 30 days, they're not agreeing to do anything for you. And then plus they charge an administrative fee of like $100, even though you only see 2 claims per month from that particular payer. And doctors sign it without negotiating. So it's not too hard to run across somebody in that same meeting that will say they got the same phone call, they negotiated 15% down to 2%, they negotiated $100 a month down to $10, and they see about 100 patients on that particular plan. And the difference is, one doctor understands her rights or his rights to negotiate and actually does that before they pick up their pen and sign the papers. And this was alluded to several times earlier this afternoon. The delivery of excellent patient care. There is no healthcare profession that's better than optometry in doing just exactly that. And we have so much to be proud of, and yet our self-esteem is somewhere down around the level of some critter that lives on the bottom of the ocean. And I've never understood, obviously I don't have any problem with self-esteem, but many of us seem to have a problem with self-esteem, and I've never understood it. But when you think about it, what is the true test of the value or the accuracy and efficacy of a professional service? Insurance rates. You know, just think about it. The average ophthalmologist would kill to have insurance rates as low as ours. $600 a year for $2 million coverage, and that's unheard of in a profession that's providing medical care on a regular basis. That's a measure of how good we are, and it's time we understand that. So we're doing AOA volunteer staff website can provide some tools for you, and you probably noticed over the last couple of years, Third-Party Center and Clinical Practice Advancement Group, Federal Relations and State Government Relations, everybody is providing you with tools to do a better job of whatever it is you want to do. So now you'll watch for tools coming out to help you in your decision-making process relative to insurance contracts and other business decisions that you face. Why don't my colleagues insist that insurers modify contracts to respect optometrist value and scope of practice. Why don't they do that? They don't do it because we have not insisted. Individually, which then becomes a mass, individually we have not insisted that we're just not going to accept a contract that does not respect our full scope of practice and the value that we provide the system. Why don't insurers follow the HIPAA mandates and follow national rules for coding and reporting services? Why don't they? Could it be that we have not asked that question often enough? I mean, refraction has been separate service for 18 years. And yet there are insurance companies that include refraction as part of an office visit, which has not been the case since 1992. Refraction has had its own code since 1993. So even given the benefit of the doubt, that's a full 17 years. I mean, complex insurance or complex computer systems, man, that's pretty complex. But suffice it to say, I would venture a guess that insurance companies' computers have probably been totally revamped several times in the last 17 years. So we can't let those excuses lie anymore. OD needs to carefully consider every contract before signing it. Every OD needs to insist that payers respect OD's scope of practice. Every OD needs to insist that payers follow the national rules. There are only 3 sets. You all know by heart. CPT, ICD-9, and the documentation guidelines. It's not that tough. In eye care, the documentation guidelines reside in 12 pages. What can be the earthly reason that a payer would miss up and not actually know the definitions of these services? Every OD needs to insist that payers follow those national rules. Every OD needs to seek assistance and tools to measure the contracts that apply to that particular practice, and then to very carefully choose which ones, and to choose them on purpose, not because Joe and Susie and Sally and Fred have already signed them and you know they have. Every OD needs to push consultants and associations to come up with additional help. I mean, it's past time for us to say we need better tools and to start locally with our own accounts, and then if we discover something, to push it upstream, to push it up to the state affiliates and to push it up to the AOA so that it can be spread more broadly for individual use by individual optometrists. I coined the phrase bright line. And obviously, I've already excused my age several times. I have no idea whether that's actually but it's a good one. Bright line. So if you imagine a graph where 0 is probably the least you would accept, although I'm not sure of that, based on some of the recent advertisements that I've seen in the newspaper, free eye exams, 2 pairs of glasses for $1.50, you know, that kind of stuff. So maybe somebody would sign a contract that was $0. I recently saw one, and I consulted the doctors before they signed. It shows how good I am. But they were signing an HMO contract that was going to pay $25 a point and Medicare's relative values. Those of you that are familiar with that know that Medicare pays $36.07. So this is a contract that would basically be about a third, 30% below Medicare payment. They're going to accept it because the contract didn't cover materials. So somehow they were going to magically make up all the money on their medical care that they were losing and on their comprehensive ophthalmological services and office visits based on the materials. Well, wake up and smell whatever it is we're smelling, and I don't think it's coffee. But what do you suppose the next step is? Isn't that same HMO going to sign a contract for a reduced fee for materials? I mean, why wouldn't they? So now the patient's going to be getting the free materials from that $1 a month plan for a $1.50 copay. Then where do you hide? Where do you hide after that? You're sitting there with that crappy contract you signed, and all the other people got smart. It's business. It's dollars. It's dollars. If that HMO can get all these services, these beautiful glasses and these excellent services provided by optometrists for $1.50, they'll by golly do it. And you can't fault them.